Breast cancer is the most common type of cancer, affecting almost 1 in 8 women. The incidence of breast cancer is 4 to 7 times higher in the US and Europe than anywhere else. This brings us to the question of how do breast cells become cancerous? Various factors determine the risk of breast cancer. Let's learn all about them in today's video. Firstly, it will be useful to know what breasts are made of. The anatomy of the female breast consists of different types of fatty, fibrous, and glandular tissues. The glandular tissues help produce milk from small ducts and lobules. How does breast cancer occur? It starts with a precancerous condition that causes abnormal growth of the breast cells. This condition is called atypical hyperplasia. Eventually, this condition can increase the risk of invasive carcinoma of the breast. If left untreated, the cancer cells from the breast have the potential to grow out of control and invade the surrounding tissues. The continuous accumulation of these cancerous cells forms a lump or a mass, leading to tumor formation. Types of breast cancer. Based on the location, breast cancer can be classified into the following types. The first type is carcinoma in situ. The second is invasive carcinoma. Under carcinoma in situ, the cancer cells are confined to the ducts and lobules of the breast. This type of cancer cannot metastasize or spread. The second type is invasive carcinoma of the breast, where the cancer cells from inside the milk ducts or lobules break out into the nearby breast tissue. Signs of breast cancer. In general, the body produces certain warning signs. The most common is the breast lump, which may be located anywhere along the chest wall or the armpits. You may have nipple bleeding or discharge, as well as pain in the area. There may be redness or swelling in any area of the breast, or your nipple could look flatter or caved in. Risk factors. Studies have shown that your risk for breast cancer is due to a combination of factors. However, the main factors that influence your risk include being a woman and increasing age. For white women, it is 61 years. For Hispanic women, it is 56. And for African American women, it is 46. Some other factors are the age of early menarche or late menopause and the age at which the woman gives birth. Women who don't have full-term pregnancies or have their first child after 35 years of age have an increased risk. Then, of course, we have to talk about genetics. Having a first-degree female relative, like a mother, sister, or daughter, with a prior history of breast cancer can also be a risk. Even some germline mutations of the breast cancer, gene BRCA1 and BRCA2, can increase your risk. Now that we have spoken about the risk, let's talk about how you can diagnose breast cancer. Breast self-exam, or regularly examining your breasts on your own, can be an important way to find breast cancer at an early stage when it's more likely to be treated successfully. For women, the best time to do a monthly self-breast exam is about 3 to 5 days after your period starts. Do it at the same time every month, as your breasts are not as tender or lumpy at this time in your monthly cycle. Apart from a breast exam, your doctor may conduct a breast ultrasound, diagnostic mammogram, or biopsies to diagnose breast cancer. Staging of breast cancer. If breast cancer is diagnosed, other tests are done to determine if cancer cells have spread within the breast or to other parts of the body. This process is called staging. The TNM staging is most commonly used to stage breast cancer in 3 ways. The first criteria is the size. Depending on the size, the tumor can be classified into 4 stages: T1, T2, T3, and T4. T1 stage is when the tumor size is less than 2 centimeters. T2 is when the tumor size is 2 to 5 centimeters. T3, when the tumor size is greater than 5 centimeters. And T4 is when the tumor of any size is with direct extension to the chest wall or skin. The second type of staging is based on the number of lymph nodes affected. Cancer spreads when cancer cells break away from the primary tumor. In breast cancer, these cells are most likely to reach the lymph nodes closest to the affected breast and spread to the rest of the body. There are 4 different stages here: N0 to N3. N0 is when the tumor cells show no lymph node metastasis or spreading. N1 stage is when the tumor cells show metastatic involvement of about 1 to 3 axillary lymph nodes. N2 stage is when the tumor starts to spread to the 4 to 9 axillary lymph nodes. N3 stage is the metastatic involvement of infra or supraclavicular lymph nodes. In this stage, more than 10 axillary lymph nodes are affected. The third type is the metastasis staging. Metastasis is the spread of cancer cells to new areas of the body, often by way of lymph system or bloodstream. Here, the stages are divided into 2 parts, M0 and M1. M0 is when there is no evidence of cancer metastasis, and M1 is when the cancer is found in other areas of the body. Now you know the signs, risks, diagnosis, and staging of breast cancer. You can watch all these videos in their full version on the MediMagic app. We have explained all the processes using amazing 3D visuals. Download the MediMagic app. The link is in the description box below, and enjoy free 14-day trial of the app. We hope you liked this video. If you did, share it with your classmates and subscribe to MediMagic.